Hello, everyone. My name is Anthony Tioli. I'm a physiotherapist working in private practice in Rosemere, Quebec, in Canada. I'm a PhD student in rehabilitation science at McGill University with a focus on knee osteoarthritis research, and I'm the president and founder of Info Physiotherapy. I recently wrote a blog article on the surgical management for knee osteoarthritis in collaboration with Formation. So today I'd like to make a 5-minute video just summarizing the article that I wrote. For the purpose of the article, I only focused on 2 surgical procedures, so knee arthroscopy and total knee replacement. For knee arthroscopy, it's actually the most common orthopedic procedure that's performed in the United States, with approximately 700,000 arthroscopic partial meniscectomies being performed annually in the US alone, with annual direct medical costs estimated at about $4 billion. Recent evidence has put into question the utility of this procedure within the surgical management of knee osteoarthritis. In 2013, this study demonstrated that arthroscopic partial meniscectomy combined with PT provided no better relief of symptoms versus physiotherapy alone in patients with a meniscal tear and knee osteoarthritis. And a randomized control trial of a 1-year and 2-year follow-up published in 2013 and 2018 demonstrated that it was actually no better than a sham surgery, so the diagnostic arthroscopy procedure. To top things off, a study published in 2019 demonstrated that in a cohort of individuals who had a history of arthroscopic partial meniscectomy, these individuals were at a 10 times greater risk of having a total knee arthroplasty compared to the general population. They were at a 40 times greater, they were 40 times more likely at a younger age to have a total knee arthroplasty versus the general population. They were 3 times more likely to replace the operated knee, so the knee that had undergone the arthroscopic partial meniscectomy versus the contralateral healthy knee. And women were at double the risk of having a future total knee arthroplasty versus men. So this is important to consider. So not only it's no better than sham procedure, it increases significantly the risk of needing or requiring a total knee arthroplasty in the future. And it appears to be no better than just physiotherapy alone. So we definitely have alternatives we can consider. And because of this evidence, there are currently strong recommendations against the use of arthroscopy in nearly all patients with degenerative knee disease or conditions, such as knee osteoarthritis. And further research is actually unlikely to alter this recommendation. So it's important that patients be aware of this and that healthcare professionals be aware of this. If we move on to the total knee replacement, it's another very commonly performed orthopedic procedure. In Canada, latest data would suggest over 67,000 are done. And in the US, in 2012 alone, there were over 700,000. So quite a few people having total knee replacements. And the rates are projected to increase exponentially in the future as well. So the need for total knee replacement appears to be increasing exponentially year after year. One question I often get asked is what is the general success rate for total knee arthroplasty? But we do know that approximately 20% of individuals report long-term pain after their total hip or total knee replacement for osteoarthritis. So this is important for patients to know, especially when it comes to managing their expectations. So when they're considering potentially having a knee replacement, they need to be aware that 20% still report pain in the long run. This is an interesting study taking a look at predictors of persistent pain after total knee arthroplasty, and it included 32 studies with 30,000 pooled participants, and they found that there were 6 preoperative factors that were significant predictors of persistent pain after a total knee replacement. One of them was greater number of pain sites, higher levels of preoperative pain, higher levels of catastrophizing, higher levels of depression, and higher levels of anxiety, and poorer levels of preoperative function. So what we're seeing is there are certain pain-related factors. So, being a higher level of kind of pain sensitivity, if you will, multiple pain sites, higher levels of preoperative pain, as well as some psychological or psychosocial risk factors, catastrophizing, depression, anxiety, for example, that are playing a key role in the persistence of pain after total knee arthroplasty. So the take-home messages essentially of the blog article are that arthroscopic partial meniscectomy are not recommended for most patients with knee OA. About 20% of patients report persistent pain following a total knee replacement, and this needs to be communicated to patients so that they can make an informed decision. And there are certain pain-related and psychological risk factors that are predictive of persistent pain post-total knee replacement. And the thought is that by addressing these factors preoperatively, this might be an important step in optimizing outcomes post-total knee replacement, but we don't fully know that. If you're interested in learning more about the surgical management of knee osteoarthritis, you can read the full blog article at biaformation.com.